Welcome everyone to the National WIC Association's live stream event, Innovating WIC Data Linkages with Healthcare Providers. Thank you to everyone joining us live across YouTube, LinkedIn, Facebook, and Instagram. My name is Chloe Dillaway, and I am the WIC Innovation and Technology Manager at the National WIC Association. The National WIC Association is the nonprofit voice of the 12,000 public health nutrition service provider agencies who serve over 6.7 million women, infants, and young children served by WIC. At NWA, we provide education, guidance, and support to WIC staff and drive innovation and advocacy to strengthen WIC as we work toward a nation of healthier families. So this is the inaugural event in our new series, Innovating WIC, where we will be spotlighting WIC innovation topics and projects from across the country. And today we are presenting a very exciting topic in the WIC innovation and modernization world, and that is improving coordination between WIC agencies and healthcare providers. This topic is really gaining momentum across the country, and it's in part because the work of WIC and healthcare providers is already very well intertwined. For 50 years, WIC has improved pregnancy, birth, and child nutrition outcomes for millions of participants. And it's a critical program in strengthening the healthcare system's efforts to improve maternal and child health. And in addition to the nutritious supplemental foods, WIC provides nutrition education and breastfeeding support from a highly trained nutrition and lactation workforce. And that includes registered dietitians, international board-certified lactation consultants, and breastfeeding peer counselors, all of whom complement and bolster the care received from healthcare providers for pregnant, postpartum, and breastfeeding individuals, as well as infants and children up to age 5. Through counseling and referrals, WIC encourages its participants to keep in close contact with their healthcare providers, and that includes early and regular attendance at prenatal care visits, postpartum visits, well child visits, and staying current on immunizations. However, despite their very well-aligned goals, WIC agencies and healthcare providers are often siloed, and many do not have electronic referral or communication methods. Additionally, only half of individuals who are eligible for WIC are currently enrolled in WIC. So it's clear that enhancing WIC and healthcare coordination is essential to simplify the WIC referral and enrollment process, and also to more holistically coordinate care for WIC families. So to work toward this goal, last year, the National WIC Association launched the WIC Referral and Data Sharing Pilot Program. This was made possible by funding from the Kaiser Permanente National Community Benefit Fund at the East Bay Community Foundation. And as part of this program, NWA funded pilots in Lāna'i City, Hawaii, and Los Angeles, California, to build streamlined referral and data sharing systems between WIC and healthcare providers. So today we will be hearing from the project teams themselves in a panel discussion where they will discuss their projects and the importance of WIC healthcare coordination. But first, please enjoy these short videos providing an overview of each project. As you saw in the videos, each project used different methods to improve the coordination between WIC and healthcare providers. So at Lāna'i Community Health Center, they utilized the electronic medical record, and at Northeast Valley Health Corp and Watts Healthcare WIC, they utilized the Health Information Exchange lanes. So before we turn it over to the panel, I have a few housekeeping notes. So as you have questions, please put them in the comments, and the panel will have time to answer questions at the end. And we will also be making the recording of today's event available afterward on our YouTube channel. So please join me in welcoming our panel. Jared Medeiros is the Associate Medical Director at Lāna'i Community Health Center. He is a family nurse practitioner and WIC CPA, and we are so glad to have him here to represent the Lāna'i project team and also provide us with the healthcare provider perspective in this conversation. Karen Farley is the Executive Director at the California WIC Association. She is a registered dietitian and an international board-certified lactation consultant. She led the Los Angeles project in coordination with Lanes and 2 WIC local agencies, Northeast Valley Health WIC and Watts Healthcare WIC. She has also led work at other WIC local agencies in California to develop data linkages between WIC and healthcare providers, and so we're very glad to have her here as well. And last but not least, Dr. Ali Zadeh is the Chief Medical Officer at Lanes, the Health Information Exchange in Los Angeles, who partnered on this project. And we're so glad to have him here to provide the perspective of a health information exchange organization. So thank you all so much for being here. So Jared, I'd like to start with you. Can you provide us with an overview of your project and what inspired you and your team to pursue this and what you were able to accomplish?
Sure. Yeah, thank you for the time to share, what we've been doing here as far as our project. The goal of our project was to help, further integrate the WIC services that we provide into our rural primary care clinic here at the health center. We definitely see the benefit of helping, our patients in, getting access to WIC services and making that process as streamlined as we could. And so we really focused on how can we break down barriers for our patients in accessing, primary care services and try to really focus on that, one-stop shop approach of being able to have their primary care provider directly involved with, making that initial contact with WIC and explaining the WIC program and helping with making sure that our internal work, WIC team can connect with our patients, right away to help get them, signed up with WIC. We're very unique setting, being, the smallest, populated island in the Hawaiian island chain. So as a small community, we really see the benefit that we can have in helping connect our patients to as many services as they can, as things on our island are very different from the other major populated islands where access to, even more grocery stores and the 2 stores that we have here is something that we have to, kind of take into account as we look at, helping our patients get access to these services.
Thank you so much for providing that overview. And Karen, so the California WIC Association has worked on other data linkage projects prior to this. So can you start by giving us an overview of those projects and then an overview of the pilots in LA?
Sure. So several years ago, California WIC Association, we're a state WIC association, CWA, began focusing on efforts with state programs and stakeholders to try to ensure that the WIC MIS would be interoperable with those programs for streamlined enrollment with the other programs. But those statewide efforts took a different turn, and WIC wasn't included in those statewide efforts. So CWA turned to local opportunities. And some local agencies were establishing data linkages with their own healthcare providers, either through local health information exchanges or through their electronic health records. So we learned from them and decided to focus on local linkages and the technologies of electronic health records, EHRs, health information exchanges, HIEs, or community information exchanges, CIEs, and focusing on 3 buckets: referrals to WIC, access to the needed data for enrollment and certification, and care coordination. And when talking about California, it's important to note that there are 6 types of local administrations for the WIC agencies. There are city and county health departments, some hospitals, some community and Native American health centers, and some nonprofits that have no affiliation with healthcare. So for Los Angeles, a region that is served by 7 WIC agencies, there's a mix of local administrations, FQHCs, hospital, nonprofits, and a city health department. And their collective caseload is about 300,000. Current caseload in California is a little over 1 million participants. There's no state portal in California where individuals can be referred to or go to them themselves to reach out to and input information, be referred to the WIC agency of their choice. There is a website with the state, but it's not exactly a portal where information can be inputted. So for Los Angeles, it takes a lot of local collaboration to ensure that participants reach the WIC agency they want to work with, or healthcare providers or other community members reach the correct WIC agency. So for Los Angeles, we're calling this phase 1 in our hopes to do a lot of work in Los Angeles. And the upshot of phase 1 is that we chose 2 of the QHCs to work with and work with their own patients, Northeast Valley Healthcare Corporation and Watts Healthcare that you saw in the video. Northeast Valley has a caseload of about 40,000 and Watts a little over 11,000. And then we partnered with Lanes, which is the local health information exchange. And you'll be hearing from Dr. Zadeh on this presentation. The end product was a standing order that all prenatal, infant, and child patients would receive weekly, that would be sent with the participation and collaboration of each FQHC's IT to Lanes, the FQHC, and the WIC staff would receive that roster and use that roster to cross-check the WIC MIS system to see if the person was their participant or not a WIC participant, or perhaps in another WIC agency. Then they had access to Lanes to get the contact information, which often has quite extensive contact information and history, and the needed data for enrollment and certification. And then they would reach out to the individuals to ensure they stay certified, or especially for children, or to enroll eligible but non-participating participants. And Lanes created a WIC view, so the WIC staff don't have to get into the whole medical record. They see targeted information that the WIC staff need for enrollment certification, a coding system to manage the workflow of the roster and the participant names, working with the WIC staff on that. And then together with the WIC staff, they develop coding system for identifying who's been reached and whether they want to participate in WIC or they don't, or how many calls have been made in the workflow for the WIC staff. So that's a summary of our project. Thank you.
Thank you so much. That was great. So Ali, please tell us what a health information exchange is, what it does, and why Lanes was interested in this project.
Thanks, Chloe. Thanks for this opportunity, and thanks for everybody who's taking part in this presentation. Lanes is a health information exchange, more recently a qualified health information organization in the state of California, one of 8 that's been certified by the state of California. And our role as a health information exchange is to bring data together from different health systems, medical groups, SNFs, and the like, and to be able to then share that information with participants that are part of Lanes. It's a communal effort in many ways, and we call it a public utility of the city and county of Los Angeles, a way for different providers to chip in their data, but also get in return data for their patients as it relates to other health centers or hospitals that they have been at. Now, like most things as it relates to healthcare in the United States, HIEs and HIOs are fragmented, and therefore there is not any one HIE or HIO or QHIO that has all of the data for all of the healthcare providers in the city of Los Angeles. But we at Lanes do have a certain amount of what we like to think is data that's extremely important, especially to the vulnerable population of Los Angeles, the safety net population, the Medi-Cal population. And so Lanes is the provider for DHS and DMH data that is very important and the most important safety net health system in the city and county for Medi-Cal patients. And so, the role of Lanes is really to bring that data to the fingertips of the providers who enroll with us and become part of Lanes. And in any of you who are not participants but are in the city and the county of Los Angeles are welcome to contact me after this meeting, and we can definitely try to make sure that we also are able to digest your data and then present you data for those patients that you have a relationship with. When it comes to our role with this particular project at WIC, there is a lot of history to WIC, and WIC does a very important task, an important role for women, especially women that are, facing challenges before and after childbirth and are wanting to make sure that they provide the best to this next generation of people that are going to populate our planet. And so as a result of the work that we did here in this particular work, we were instrumental in helping the community be able to, at least these two participants that participated in this pilot, be able to get the information they needed to be able to make more effective outreaches the WIC population and identify if these individuals can qualify for services and get the services that they need. And I think this is really that closed loop referral, although it's not completely closed just yet, but closed loop referral that we all believe is the next step in making healthcare much better and much easier for the safety net population in this country. And we're taking a small step in that direction with the work that we did on the WIC pilot with our partners, like Karen and the team that's on this call.
Thank you so much. That was really helpful. So Jared, back to you. As a healthcare provider, you're being pulled in multiple directions. Tell us how you talk about WIC with your patients and how you encouraged other providers at your health center to do the same.
Yeah, so we really approached this project with how can we make, our patients' access to the WIC program, seamless within primary care. And so how we explain WIC to our patients is how this, the WIC program can benefit them, with all the nutrition benefits and education to help, mothers who, are pregnant. Lāna'i is also very unique in which all of our pregnant patients have to actually leave the island to have their babies. So we're having mothers relocate to Maui or Oahu in the last 4 weeks of their pregnancy. So it's a very unique situation that, we undertake living here on the island. It's very easy to be on a small rural island where we can see all the things that we don't have and what we're lacking. And we really try to see our integration, innovation of what we do here in a primary care clinic of how can we bring services to our patients and making, these barriers, just drop down and help our vulnerable population here who, need to have as much support as they can to help, be healthy and to have good nutrition. So we utilize, this system through our medical providers who, are seeing our patients, for their initial, pregnancy tests and prenatal care. And we can immediately kind of help talk about how, hey, there is a program that we also help our patients here at the health center called WIC, and we go on and forward and explain. I think that really helps build trust with our patients that, hey, my medical provider is actually talking about WIC. Maybe I'm going to, look more into this. And it's actually really helpful for our providers to utilize this system that we've created to actually create an internal referral that goes to our referral team. And one of our WIC members on our team is part of the referral team. So all these referrals are captured through that WIC staff member, and in turn automatically, kind of proceeding forward to, work through and get the patient, on our WIC program. It's a lot different than kind of just, encouraging our patients, hey, you should think about WIC, here's a handout. I hope you call them. And this way we can really help our team be proactive in reaching out to our patients and saying, hey, remember when Jared talked about the WIC program? Well, my name is so and so and I'm from WIC, and we really wanted to help encourage that you could set a time that we can meet with you. And we operate WIC out of our health center too, so our patients are very familiar with where they come for care and where they can come for WIC. And being on an island with only 2 grocery stores, we are surviving on a barge that has to come from Honolulu to our island once a week. And so it's not uncommon for weather to impact that barge not being able to come to our island. And when you go to the store, there's no milk, there's no frozen chicken. You're going to have to change your dinner plans because it's just not available. And so by utilizing this program, we can help ensure that our patients, can have access to all those different food benefits. And not only that, but the nutrition side as well. And so we really see the benefit in kind of being, again, that one-stop shop for our patients. They know who they can turn to on this small island to kind of help connect them, to those services. And, when we first started WIC, several years ago, we've noticed our caseload, was very small. It was, below 80. And now, we recently had our highest for the year, which is about 111. And I know that seems very small for, all of the other WIC agencies, but for us on a small island with about a population of 2,800 people, we really strive to encourage, how can we, utilize this program to just make it seamless within primary care. And again, having the healthcare providers be, that introduction for, the WIC clients of like, man, my provider mentioned this, so it's something that I can trust and get good, accurate information to help build, our participants to access WIC.
Yeah, thank you so much for providing that perspective on how important the healthcare provider is in the WIC referral process. So Karen, you led a multidisciplinary team of partners on this project. So tell us about how all the partners work together, what each partner's role was, and what types of agreements were signed. Oh, I think you're muted.
It was a team effort, and the success of this goes to all the team members who contributed their time. Everybody is so busy in WIC agencies and health centers, and we just really appreciate everybody's commitment. So from the WIC side, initially it was the WIC directors and deputy directors who worked with lanes and the other health center staff to come up with the plan and how they were going to structure this and initially test it. But since it's been rolled out, the frontline staff are now receiving the rosters and the referrals and going into WIC-wise and reaching out to the participants. From the FQHC side, the women's health participated, women's health staff, pediatric staff participated, the IT staff were integral. The IT staff helped create the rosters of appointments and worked with lanes on the integration. And then the CEOs and the COOs were supportive of this type of modernization and collaboration between WIC and the health center side. And then the lanes brought in quite a big team of their design experts and their project managers to help us think through this. These types of projects are new for health information exchanges. Health information exchanges, EHRs, they're used to working with healthcare providers, and WIC and other community partners who want to start exchanging data are new partners. So it was important to get to know each other, and they brought a big team in. And then Lane's team created a WIC view. I mentioned that. So rather than the WIC staff having to go through the whole medical record, WIC staff just sees a very focused view, and it's much faster for them, and it's really a better protection of patient data. Initially, we were going to have a one-button referral that the healthcare providers or staff would push, and Lanes created that, but then the team decided that they wanted to go with a roster and the standing order. So they created that, and then the dashboard and the coding system. And as far as an agreement, this project didn't require an agreement because we're working with the WIC staff who are employed by those health centers, but the WIC staff did have to get authorization through the Lanes process to access Lanes because they hadn't been accessing Lanes. We've worked on another project in another part of the state where with a nonprofit WIC agency that didn't have access to healthcare and working with a different HIE, and they had to get an agreement, BAA, business. I can't remember what it means for the agreement to access the data. So that had to be established before the WIC staff could be authorized to get into the HIE. So that was the team.
Great, big team. It sounds like everyone came together to really accomplish a lot. So I'll turn it back to Jared. So I'd love to hear, what are the early results of the new referral and data access system, and what impacts are you seeing on WIC participants, the WIC team members at your health center, and also healthcare providers?
Yeah, thank you. The early impacts we're seeing is, again, just that integration from the start. Instead of having a delay in our patients getting access to WIC services, we just make it a part of our care delivery that we do when we actually see our patients. So we have it integrated to where the providers are all trained to, when they see a patient that, would qualify for WIC, they immediately initiate that referral. And that really helps bridge, that gap of, kind of putting it in the hands of the patient to, get that process started. And this also ensures that, as providers, we can ensure that there's good communication between the healthcare provider team and then also our WIC team. Our goals of how we can look at this impacting, our patients. I clearly remember seeing a patient who was new to our island. They just moved here. So again, trying to get their bearings straight is always something that we're helping our patients out. And so by utilizing this referral process, I could immediately create that referral and just really help connect this patient to have, this whole foundation of support. Moving to a new island that is completely different than any other island in the state, where, finding out what resources are available and like, how do you, order this or that? We really try to help mitigate all that by, our good outreach program, and, the WIC program helps with that as well. For healthcare providers, I think it's really streamlined, how they conceptualize WIC. When I first started as a provider over 10 years ago, when someone mentioned WIC, I was kind of like, oh, what's WIC? I don't know what that is, And so I think this really helps break down that barrier for healthcare providers to see how WIC benefits them as a provider in helping their patients, get good support and nutrition education. And, we can see that, by bridging that gap of breaking down the barriers for providers of seeing how WIC can benefit, the overall healthcare system is pivotal. We have patients, like I mentioned, who have to relocate to a different island, to await delivery of their child, of their baby. And so by, ensuring that, they have WIC set up, they can get access to, to those WIC benefits on another island, when they're living separately from their home care. And that's really key to just ensure that, with the rising cost of living in Hawaii, which is felt everywhere, but a little bit more magnified here in Hawaii, where everything is brought in, we're heavily reliant on the shipping, of things into our state. This really breaks down, those kind of barriers of helping our patients, get access to WIC. For our WIC staff, it's really helped streamline, the process of referrals, by having this integrated into our electronic medical record system. Our, WIC staff members can see the referrals. They're able to, access that data, and then also, things for the WIC certification as well, as far as for, the biometrics and things they're able to access as well. And that really has helped, kind of increase the ability of the WIC team to, again, just be integrated within the health center and what we deliver when it comes to primary care.
Thank you so much. And Karen, what impacts are the two local agencies that you worked with in LA seeing so far with the new referral and data sharing system?
Positive impacts. So the Northeast Valley, when they looked at their initial set of referrals, found 30% of the referrals were eligible but not participating participants. So they were happy to receive those and reach out to patients, participants. And Watts said 10% of the referrals were eligible but not participating. So that was a streamlined outreach opportunity for them. and the workflow that was created, being able to get the electronic information, get into lanes, cross-check against the WIC-WISE was a big time saver. WIC-WISE isn't interoperable. The data isn't loading into WIC-WISE, which would save more time, but it's a much bigger time saver than asking the participants to bring in everything. And now with a lot of remote services being provided by WIC, we're more dependent on electronic linkages. And so even asking patients to get screenshots or photographs and then send it over to WIC and load that up, it's very cumbersome, but this was much more streamlined. So from the participants' experience, it was much more human-centered design. And the WIC staff reported that the participants were happy to hear that their medical providers recommended that they use WIC and that there was a connection there. So the WIC staff were happy that the participants were happy with this, and a time saving again for the participants and a much more human-centered design. And then the women's health staff and the PED staff and the leadership at the health centers and the IT staff were happy to participate. They, just like Jared just described, they want to have WIC get all the referrals and eligible participants that can participate and serve them in an efficient manner and more closely link WIC to healthcare. So everybody was happy with the outcomes. And of course, it's early in the project. There'll be continued monitoring to see the outcomes and some fine tuning.
Great, thank you for sharing. Sounds like it really has had a big impact so far, and it's still very early. So,
Yeah.
So Ali, from your perspective, how are healthcare providers, health information exchanges, and WIC agencies aligned in their goals? And what role can a health information exchange play in supporting both WIC and the medical field in improving maternal and child health outcomes?
Thanks, Chloe. Healthcare providers and HIEs, WIC agencies, we all have a similar goal, and that is to help serve patients. Some of us do that in an ancillary way, in the case of HIEs, providing data for others to make decisions on them. And the same goes with WIC in many ways. And then there are others that provide direct patient care. So they're all aligned around this idea of providing better care. Now, over the years, what we've realized as a society is that somebody's health outcomes, if you will, are shaped not just by the drugs that they take, right, or the prescriptions that they take, but by the full context, the full complement of services that they receive that impact them. Every day, whatever we eat impacts us in many ways, our health and our health outcomes. And so the goal of all of these organizations is aligned in providing better care. We know from the empirical evidence, many of the peer-reviewed literature out there, that health information exchanges provide greater data, and greater data to make decisions on when used effectively, right? We don't want to just overload with data, but when used effectively for a particular goal, can help in patient care. And so that's how they're aligned. And that's why I think this project thus far, to Karen's point, has been a success. And certainly in the future iterations of what we're doing together, we want to improve and learn from the experiences that we've had in the past and make it even better for the patient, for the participant. The role of HIEs in supporting WIC and really improving maternal and child health cannot be understated. When you think about maternal and child health, you think about a continuum, right? That starts at the time of conception and goes all the way to after the time that a mother gives birth, and then the many months after and many years after that she cares for that child. And this is an especially pivotal time because moms and babies face a lot of challenges during this time. And as we all know, the care for that mom during the prenatal period happens at a PCP office, hopefully, right? I mean, that's the idea here. And so whether it's at Northeast Valley, at Watts Clinic, or any of the other medical groups or FQHCs in the city or county of Los Angeles, that care happens. And once that care happens, then at some point, this individual, goes to a hospital to give birth. And this is where the HIE role becomes pivotal, because when this expectant mom goes to the hospital, the importance of having that data of all of their visits prior, all of the ultrasound images, all of the lab results, whether or not there was cases of preeclampsia or eclampsia or diabetes or anything else that was there during those 9 months that she was holding this baby for that special day, is so important to those hospital providers, and is important in the care of that mom, both in the perinatal and postnatal period. So HIEs are very specially, I think, useful in many different ways because of the data. But I think especially in the expectant mom, provide a very crucial role, especially for people in underserved communities who oftentimes do not have the resources or the transportation or the other support systems to come into a hospital and come in with all the CD-ROMs and all the other information they need of their old ultrasounds and all of the previous notes that a physician took in the office. I mean, you think about the amount of work that people go through sometimes to get old medical records, and you all know this who are on this call, from a PCP office or a hospital, and imagine having to do that for an expectant mom. This is why the role of an HIE is so important, because providing that data between that clinic and that hospital and allowing them to share this information allows that mom to seamlessly go to the hospital, get the care she needs, and make sure that that baby is born healthy and then gets the care that they need afterwards and gets the support, in this case, through WIC after birth as well.
Thank you so much. That was really helpful. So Karen and Jared, I'd love to hear more from your projects about what the biggest challenges were in implementation and how you overcame them. And then along those lines, from the lessons that you learned, what advice would you give other health centers or practices and WIC agencies looking to establish those linkages? What should they be thinking about? So Jared, do you want to start?
Yeah, sure. Probably the biggest challenge for us was just the interoperability between our electronic medical record system and the WIC MIS system. They're two completely different systems, and so initially we had really high hopes and goals of helping data transfer between the two platforms, and in working with our state agency and discussing how the WIC MIS system works for Hawaii. We quickly learned that would be a really long-term thing to try to work. And, with the time frame of the grant, we had to really adjust to see how we could make this work. And it was also a really high hope and goal for us as a health center to also change our electronic medical record system to another platform. I won't mention the name, but it's widely used in the United States. And it's, the main electronic medical record system for all the hospitals in Hawaii as well. And so it just makes sense for us in the future going forward to, transition to a medical record system that can help, our state kind of connect widely. So that was the biggest challenge for us was, how can we have, that connection between the platforms to not be different. I mean, I think that's what we're all striving for is, how can WIC communicate back to the healthcare provider team or, the primary care clinic of like, hey, this is what we talked about with your patient, besides just kind of looking for the med doc to get signed for when there's special, formula. As a healthcare provider, it really helps us to kind of be on the same page as all of our, agencies that are delivering care to our patients. And I agree with my, presenters here that, we're all striving for that interoperability between, knowing, what our patient is getting access to and how can we all help that patient. That's always the big goal here is, how can we make this experience for our patients, seamless, easy, convenient, making life easier for our patients and making sure that they get high quality care is always what we're about. So yeah, we definitely hope to in the future continue to work with our state agency to see, how can we kind of get this interoperability between, getting transfer back of data. Like how can we get all the data from our EMR to get right into WIC? So that, like Karen mentioned, you know, that extra step of our WIC staff having to manually type in everything. Like how can we make that easier for everybody across the board?
Thank you. Those are great things to be thinking about. And Karen, do you want to go next?
Sure. Well, as Jared so eloquently described, this is not an end goal, our project. It's a first step. And some of those end goals of interoperability and streamlining are definitely of interest to the WIC agencies and healthcare partners. But for this project, what we found helpful was getting all the partners together initially so they can get to know each other. And, lanes needed time to get to understand WIC, and the WIC agencies needed time to understand lanes. And we've been on a learning curve the last couple of years here in California, trying to help the WIC agencies understand the health technology partners. And then bringing in the health center side staff and the IT staff so that everybody could discuss what the goal was, and then identify the details that would reach that goal. The goal being getting referrals and access to the data and care coordination. And then together they worked on the workflows and discussed the different technologies that were being used and which health center staff were willing to use which technologies to make the referrals or send the information, and then ultimately ending up with the standing order. So it was a process of committing time to having meetings and just kind of working through, getting to know each other, identifying the goals, what's the technology, what's the existing workflows, and willingness to be flexible and change. And in the end, there was great flexibility and great ideas. The first idea, as I mentioned, the one button referral, isn't what the group chose. So they stuck with it and said, let's try this other idea. So that partnership and willingness to put in the time and brainstorm together, and also talk about the realities of what it's like in the health center for the staff and what it's like for the WIC staff and what the technology can provide were really important. So that's stage one, but at this point it was pretty easy because of the willingness and collaboration of the partners. So all thanks to them.
I think that's very helpful to be thinking about, is just not being married to the fact that your first idea will be what you end up with. I think that flexibility is really key. So I'd love to hear from all of you, sort of what are your next steps? What are you thinking about for expansion for your projects? And you have touched on this, like interoperability is a goal, but what else are you thinking about for the future? Ali, do you want to start?
Sure, Chloe. I think for us, obviously replicating what we've done with Northeast Valley and with Watts, with many other clinics, would be a great place to go. But also finding ways to remove the bottlenecks for the VIC staff at these organizations as they exist now, so that they can be able to accomplish the goals that they have with getting these referrals, with being able to care for these patients. So I think those are the two major areas that we are looking to grow. And then I think many of the lessons learned through VIC are applicable in other CBO situations where, we're working with organizations that are like VIC, providing a very necessary service to people who are very vulnerable, who are in that safety net. And it's our goal to develop those linkages and increase the linkage really primarily around not just the medical to medical, provider to provider, but medical to social components of medicine that are so important to the well-being of patients.
Karen, will you share what else you're thinking about for the future of these projects and beyond?
Sure. So we're hoping to continue the work in Los Angeles. As I mentioned, there are 7 WIC agencies, and we worked with 2 of them. And there is no central referral portal. So staying with the local efforts. The next step we'd like to do is to bring in the other 2 FQHCs in a hospital that participate in lanes, and set up the same system with their own patients. And then from there, move on to the nonprofits that serve the nonprofit-based WIC agencies, and partner with some other FQHCs in the community who would be willing to pilot sending their patient referrals over to the WIC agencies. And that still won't cover everything. That's not a blanket situation, but from those two stages, we can learn a lot and then hopefully apply that to the future.
And Jared, do you want to share anything about what's next for your project?
Sure, yeah. We have already been discussing with the other primary care clinic here on the island to help with generating electronic referrals within their electronic medical records system. And so the goal would be, again, to help kind of just build that synergy in the healthcare setting of having, providers externally of our health center create referrals for the patients that they see, and in turn can be processed like a regular medical referral from their primary care provider that gets sent to us electronically. So again, trying to really help build that referral process from the healthcare providers to WIC, and looking at our external healthcare providers of how they can kind of build and work with us to develop that process. And of course, I think overall for the state, for Hawaii, would be to see hopefully that we can kind of build this into other federally qualified health centers who are providing WIC services, to see how they can also build on this whole goal of integrating WIC and making WIC become part of the health center, and in turn just making the referral process just streamlined. And I think we all kind of share that same goal for all the local agency WICs who operate out of the health center, to again, how can we just make life easier for the WIC staff who are health center employees, kind of have this whole integration of data. Obviously that's a big thing that would really help with making things easier.
Thank you all for all of that. This has been really helpful. And as we're reaching the end, I just want to invite everyone to share their closing thoughts. We've heard a lot today about the benefits of streamlining data linkages between WIC and healthcare providers. And just let me know what you're thinking, what your closing thoughts are on this topic. Karen, do you want to start?
Sure. Well, as you opened, Chloe, you mentioned how WIC was structured to be an adjunct to healthcare, and WIC has the largest nutrition and lactation workforce in the nation, and they're highly trained staff. And as Jared and Dr. Zadeh also supported the importance of WIC and healthcare providers working in close contact for good patient outcomes and ultimately positive population health outcomes. So this effort and other efforts across the country are really in support of that, and helping the WIC staff and the healthcare providers work more closely as we try to change the healthcare outcomes of the WIC program, which the program, now in its 50th year, has great data to support that. And this is just one more avenue to do that.
Thank you so much. Jared, do you want to share your closing thoughts?
Yeah, I would just encourage, how we look at the healthcare provider and WIC. I think that's a very, important thing that we, should look at focusing on, of how can we get our healthcare providers to be advocates for WIC, and to be, the first contact for, our, WIC clients to hear about WIC. When healthcare providers are, sharing education and, seeing all of these children, for their well child checks and, checking all these milestones, it's a really good opportunity for, the healthcare provider to just be a key part of this WIC circle of care. And I think just breaking down the barriers for that is really, immensely important for what we're all trying to do here of, linking our patients, with the extreme benefits that WIC provides.
Thank you so much. And Ali, please share your closing thoughts.
Yeah, thanks, Chloe. I think, as a society, we live in more and more silos every day, whether it's politically, whether it's the communities that we live in and the silos that they provide, and sometimes even the diversity of our friends and neighbors. I think what health information exchange provides is a really important tool to help break down those silos in health data. And when there is a emergency, we all know when we call 911, we don't care where that person comes from or who they are, as long as they come and provide that care to us in the earliest amount, shortest amount of time possible. And I think WIC, I'm so appreciative to the efforts of the WIC organization nationally as well as at the state level for giving lanes an opportunity to showcase the value of health information exchange and giving us an opportunity to really provide a real life example of how health information exchange can really impact the care of patients. So I think those are all really positive things that we can build on in the future.
Thank you all so much. This has been a really important conversation and a great discussion. So I just want to thank you all for your work in this field. And I think the whole discussion really underscores the many benefits of fostering healthcare partnerships with WIC. And it's clear that there's been documented impacts on improving just processes for WIC participants, WIC staff, and healthcare providers. So it's a win-win-win situation. So I just want to share, for more information on these Hawaii and California projects, we will be displaying a link at the end of this presentation. We have developed detailed case studies and a new section in our healthcare provider toolkit based on the learnings from these projects. And thank you again to the Kaiser Permanente National Community Benefit Fund at the East Bay Community Foundation for supporting this work. So thank you to the audience for putting your questions in the comments, and we will have our panelists answer them in a moment. But before we go to questions, if you're interested in learning more about these projects, as well as other emerging developments in WIC technology and innovation, we invite you to join us next week. We are having our National WIC Association Virtual Technology, Innovation, and Vendor Management Conference. It's on August 6th and 7th. And both the Lāna'i and Los Angeles project teams will be presenting a more in-depth look at their projects and how they were set up. You'll also have the opportunity to learn about other topics like data matching, WIC online shopping, AI, data dashboards, and a lot more. So last chance registration is still open for the event, and we would love to see you there. So I think we'll go to audience questions now. Thank you, everyone, for joining us today. We have one question for both the Lāna'i and LA projects. So tell us, is the medical provider able to see in WIC enrollment or recertification status in the patient's medical record or in the HIE? Jared, can you tell us how that worked in your project?
Sure. So the medical provider is able to see the kind of notes of the referral. So it is like I guess you could say, an added thing that we've done with this process is whenever there's a referral created, our WIC staff member will make notes in that referral that the healthcare provider can see, and it can be a simple note of patient was reached out to, WIC appointment scheduled, WIC appointment completed. So the healthcare provider just sees that. They don't see the specifics as if they are certified or recertified or due for certification. So that part is something that is a very good point to bring up, that it would be great if we could definitely just have like a little tab right there on our patient medical record that we can just see like a real simple, yep, they got WIC certified, they're good to go, they're getting WIC benefits. And that's something that I would love to see from the WIC MIS system of, again, how can the WIC system communicate back to the healthcare provider of like, hey, these are the benefits your patient is getting. This is the topics that we discuss. They mention, having questions about this or that, and it just can be more of an opportunity for WIC to help integrate back into the healthcare provider's part to help, our patients kind of get, that care that the WIC staff is maybe picking up on that could be addressed in the primary care setting.
Thank you. And Karen, how did that work? Are the providers able to see enrollment or recertification data?
No, they might be able to get aggregate data when the WIC staff are able to start showing some of those evaluation results. But no, that would involve consent to share the data back. And right now, we're really just asking the WIC agencies to commit to learning about and participating in ways to receive the data, which is a significant amount of time for them right now to be involved in these projects and change their staffing processes. So eventually, and that would be, as Dr. Zade referred to, a thoroughly closed loop referral, where the information would go back. But now WIC knows who's been contacted, who declined, who was enrolled, who couldn't be contacted, but all that coding, only WIC understands that coding and has that data. And from this project and other projects, WIC can acknowledge referral received by WIC, but that's as far as the information goes. So at this point.
Thank you both. All right, well, thank you so much to the panelists and to everyone who joined us today live. And we hope everyone has a great rest of your day.
Happy World Breastfeeding Month.
Thank you.
Thank you.